Assalamu alaikum and welcome to the Dr. UUT channel. In this video, we will talk about the digoxin. Well, before I proceed, I would love to mention that this video is available in Urdu. So now we'll commence the lecture in English. Coming to the point, what will we study in this video? Site of action of digoxin, the mechanism of action of digoxin, and the uses of the digoxin. Well, coming to the first point, digoxin site of action. What is the site of action? Its site of actions are two. The very first one is on the myocardial cell and the very second one is on the parasympathetic nervous system. First, let us know about its site a little bit. In the myocardial cell, we know that we have sodium channel, potassium channel, and sodium-potassium ATPases pump and sodium-calcium pump or transporter. What happens normally is that sodium will move inside the cell and potassium will move outside the cell through the sodium-potassium channels when an action potential reaches. And here we have another pump that is called a sodium-potassium ATPases. This pump is responsible to pump the sodium outside the cell and potassium into the cell in order to bring the cell back into the resting state. We know when sodium moves inside, it makes inside positive. In the beginning, it was supposed to be negative, but now due to the influx of sodium, it became positive. So this pump wants to bring the cell back into the normal state, means back into the negative state. So it will move or pump out the sodium outside. So like this, what will happen? Inside will become negative, and as sodium moves out, so the outside will become automatically positive. So in short, this pump is responsible to bring the cell in a stable state, in a resting state. And we have the sodium-calcium pump, through which what will happen, the sodium will move out and calcium will move in. This is the normal mechanism of the myocardial cell. Now, what is the mechanism of action of the digoxin on the first site? Means site of actions we have two, myocardial cells and parasympathetic. And now we'll come towards the mechanism of actions of each. So mechanism of action on the myocardial cell of digoxin is very simple. How? That digoxin actually targets the sodium-potassium pump, means it is inhibiting. Here is a negative sign. This inhibits, digoxin inhibits the sodium-potassium pump. So what happens here, when this pump is inhibited or blocked, so there will be no any outflow or efflux of the sodium and influx of the potassium. So it will be blocked. What will happen when the action potential reaches? The sodium will move in and it will make inside the cell positive, and sodium concentration will increase here. And we know that we have another pump here known as sodium-calcium pump. Now this sodium has just one path left, that is of this pump, because now it is blocked by digoxin. This sodium will move out and the calcium will come in. Like this, the sodium will start moving out and the calcium will start moving in. So there will be a large influx of calcium, and as you know that calcium concentration increases inside the myocardial cell, and we also know that the calcium is responsible to do the contraction. If you remember about the actin, myosin, troponin, tropomyosin, where the calcium plays a very important role in the contraction of the muscle. If it is about the skeletal muscle or cardiac muscle or smooth muscles. Well, here when the calcium concentration increases, so it will cause what? Increase in the contraction of the muscle, because it is responsible to do the muscle contraction. Calcium plays a very important role. Coming to the next point, that is it's a site of action on the parasympathetic nervous system. So according to general understandings, that parasympathetic system is responsible to bring the body in a rest and digest condition. You know, it is responsible for the rest and digest. So it has a very important role on the heart also. So the SAN and AV node, they have the supply of the parasympathetic nervous system also, though it has the supply of sympathetic nervous system. So now we are talking about the parasympathetic nervous system. So when the parasympathetic nervous system, specifically the vagus nerve, when it is activated, it will cause the inhibition of the SAN and AV node. And you know, the SAN and AV node, the SAN is responsible to generate the impulse. Impulse will be generated here, impulse formation. Then this impulse will be then transferred and forwarded towards the AV end to the contractile cells, means the heart will then do the contraction. So now when this system activates the vagus nerve, This will cause the inhibition of SAN. So the vagus nerve will actually inhibit the SAN and AV node. So now when they are inhibited, what is their job? Their job is to form the impulse. Now impulse formation is about a bit decreased. So what is now the mechanism of action of digoxin on the parasympathetic nervous system? It actually increases the vagal tone. The nerve number 10, vagus nerve, it will increase its tone. So what will happen? It will then in turn start inhibiting the SAN and AV node. Like this, impulse formation will be decreased. So according to the sites and mechanism of actions, we have the following two uses of the digoxin. The very first use of digoxin is that it is used as an anti-arrhythmic drug, and it is also used as for the cardiac failure. So the first one, how it is used for the antiarrhythmic, how will it counter the anti-arrhythmicity? You know, arrhythmics in which the heart contracts and relaxes in a very out-balanced way, means the rhythm of the heart is lost. In case of an anti-arrhythmic drug, how will we use for? So it will bring the rhythm of the heart back into a normal state. So this anti-arrhythmic mechanism of action of the digoxin is actually on the parasympathetic nervous system, by which it will cause the inhibition of the SAN and AV. Like this, when the formation of the SAN is decreased, so the anti-arrhythmicity is a bit countered, and it is also used for the atrial flutter and atrial fibrillations. And I hope you might know about the fibrillation and flutter. If not, so stay tuned with us. So we'll cover those topics in our next lecture. Well, coming to the next point, it is also used for the cardiac failure. Now, cardiac failure is what is cardiac failure? In the cardiac failure, the heart is no more able to do its job. What is the job of the heart? To pump the blood. So when the pumping action of the heart decreases, so we will give number of medications, and digoxin is also applied for that. How is it used for the cardiac failure? We know that its function is to block the sodium potassium ATPases. When this is blocked, so it was about to increase the calcium concentration by means of this pump. When the sodium concentration increases here, and it will start moving through this pump outside, and it will bring the calcium to the inside the cell, and this calcium is responsible to do the contraction of the heart. Now here we have a very important term medically that is called inotropic effect. This digoxin actually causes the positive inotropic effect. Now please do not confuse yourself with the terms inotropic and chronotropic, etc. Please leave all the terms for now, for a while. Come to the point, it is increasing the positive inotropic effect, which means that it is increasing the strength of the contraction, not the rate of the contraction. Rate means like 72 times per minute. Now that is the rate. Here, this is about contraction, means the way it is contracting once. Okay, this once contraction is actually called as inotropic effect. The way with the strength it contracts is called actually the inotropic effect. So these are actually increasing the strength, not the rate.